Thank you so much for joining us for another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And this episode is brought to you today by Dicky, Unleash the Wellness Within. It's a non-invasive, easily affordable, and highly effective approach to optimize wellness. It's a wearable device that puts better I know, say that 10 times. Let's try it again. It's a wearable device that puts frequency-based better life in your hands and on your wrists. Make sure to stick to the very end because, as usual, we have an awesome giveaway you're not going to want to miss out on. But you're not going to want to miss out on one word this next guest has to say because she's amazing. I've interviewed her before and asked her to come back on this show because of just how much I fell in love with her and what she's doing in the world. So let's welcome Dr. Casey to the show.
Hi, how are you doing?
Doing pretty awesome. Doing pretty awesome. Getting excited about the holidays coming up and, things get really pretty in Colorado and the lights. And I love this time of year.
Yeah, I love fall actually. It's a great kind of transitional, kind of calming down time of year. It's great.
I would love to move to Florida come January 1st, but that's a dream in the making because but what part of the world are you in?
We're in Chicago.
Oh
Yeah.
yeah, so you guys really get the horrible dark winters, cold, bitter cold. Yeah, no.
Yeah.
I'm spoiled here in Colorado, but I'm like I'm over it. I'm over winter. So tell us a little bit about yourself. Why did you become a doctor and why are we talking about limbic system repair? And I know you also do a lot of work with Lyme and that sort of stuff. So tell us a little bit about how you got into this line of work.
Yeah, I was one of those weird little kids who always wanted to be a doctor, so it just kind of has always been in there. And just I love helping people, and I like science, and just very curiosity driven. And so I found pretty early in my career that there was a lack of curiosity. That was missing in regular conventional medicine, and so I found integrative and functional medicine, and really kind of started to dive into the root cause of why people are sick. And through that process, I was able to help myself as well because I had some severe chronic fatigue and postural orthostatic tachycardia syndrome that I had to figure out and dive into, and the root cause being Lyme disease and some co-infections, as well as adrenal fatigue and stress from school on top of all of that. And that journey, really, those two kind of that functional medicine and the Lyme and all of that, they kind of coalesced. And once I started really looking for these infections in other people and patients, I started finding it more and more, and I started treating it more and more. And I started to really, really help people, which was just so fulfilling and wonderful. And once you start looking, you can't stop because these chronic infections are a root cause for so many problems for people, and they deserve to be looked at and explored. And it's just such an honor to help these people in their health journey.
I love how you put that there's really no curiosity in like traditional Western med. Like it's almost the exact opposite. It's like curiosity, no soup for you today. Like they squash that out. Like they see that a lot of times as a threat, right? So, anytime that you're questioning kind of the old ways, and it's still very sad to me that we're doing things so antiquated. Not much has changed when it comes to especially dealing with, don't get me wrong, Western med is amazing. If you're in a car accident, you get banged up and you need to get put back together, nothing's better. But when it comes to chronic illness, prevention, nutrition, it really does fall far from the mark. Why do you think some of that is?
Mm. That is a great question. I agree with you. We're some of the best in the world if your appendix ruptures. We've got the people that can fix it. But I think, my training, at least I can speak to when I was in med school, it was very much try to find the diagnosis and then give a pill, and treat. And I think we're kind of accustomed to that as a culture too. We just want the quick fix. We want it to be, there's a simple problem and a simple, fix and kind of go on our way. But the human body doesn't work like that. No, the human body's all connected. The heart and the gut and the brain, they don't function separately. They function together as a whole. And, more traditional healing modalities like acupuncture, traditional Chinese medicine, as an example, really takes a look at that. And they look at diabetes, for example, very uniquely in each patient. In Western medicine, it's diabetes. It's diabetes, it's diabetes. Here's your insulin. There we go. Right. But it's just so much more complex and intricate than that. And I think we're just trying to heal the masses and help people. And it's doctors are so overwhelmed, seeing 30, 40 people a day. It's a lot. We're asking too much of them. And so we just are trying to help as many people as we can. And then what happens then is you end up not being able to really truly get into the chronic illness and figure out what's going on.
Absolutely. And I mean, and if you've learned, I've heard doctor after doctor after doctor say that they get like 6 to 8 hours of nutrition education, through their whole career. Like, wrap your brain around that, the very foundation of human health, what goes in our mouth. I've even had clients come to me and they're like, oh, my cancer doc says that it doesn't matter what I eat. And it just makes my head explode because, as you know, like it's huge key to inflammation, causing leaky gut. Like, the key to health, lies with what we're putting in our mouth. And it's just sad to me that we're still fighting that old paradigm, right?
Exactly. Yeah.
So what are some of the things that you like to specialize in? Like, what kind of really gets what's your jam? Really gets you really excited. You show up to work today and you're like, yes, I get to work with another person with blank.
Blank. Yeah. I like the chronic complex mysteries. I am a problem solver. I'm a detective. I really like to kind of weed through the mess and try to slowly but surely help people come out of the weeds and feel better. So I deal with a lot of chronic complex Lyme, mold, mast cells, long hauler COVID issues, people who've been sick for quite a while. I've, for better or for worse, got quite the reputation, at least in Chicago, where I'm getting all the hard cases coming my way, that take a long time to unravel and work through. But I am persistent, and we keep looking under different rocks because these people don't feel well and they deserve to be heard and listened to. But that's what's really interesting. That's that curiosity in
Right.
me, right? Yeah, that's what drives me.
You actually absolutely have to have that curiosity when it comes to working with chronic illness. And it's sad because so many people are like, I've seen 20 practitioners and I've done all the things. And I tell people, great, now you know 20 things that don't work, right? And a lot of times that's what this is just process of elimination, keep going down that line and not giving up.
Yeah.
I know that really wasn't much of a question. I meant to leave that as a question and I kind of left it more as a statement. So my apologies. Actually, we're going to take a quick pause here. We're going to take a quick break for commercial. When we come back, I want to dive deeper into limbic system repair and chronic disease. So how the fight or flight, nervous, autonomic nervous system has to deal with chronic disease and how it gets missed so often when it comes to healing. And really, this is a magical place where healing occurs. So I can't wait to dive deeper into this. So don't go anywhere. We'll be right back.
Nikki plus Lyme is the next generation of Wave 1 technology referred to in this testimonial.
It's the Wave device. Have you been able to get back to yoga?
I have, yes. Not even just teaching, but like my own practice. That was I remember so clearly. I went to a class last year and I wasn't even able to do like a basic pose because my body was in so much pain. And that's not something I've ever experienced before. I'm sorry, I'm getting like really emotional thinking about this. But it is really hard to have things that like you almost take for granted in your daily life and then suddenly to just completely lose the ability to have those things anymore. So it almost in a way is like there are silver linings to everything, and that is a silver lining, is just like being grateful for so many of the basic things that we often don't even give a second thought to. So short answer, yes.
Nikki puts a personal wellness center in your hands and on your wrist. Be better. Do better. We are Nikki.com.
Fantastic. Welcome back. Hey, so let's dive deeper into the limbic system. First, tell us what's the limbic system?
What is the
Why,
limbic system?
and why should we care?
Well, yeah, exactly. So the limbic system is in our brainstem and it's our emotional center. And what's interesting is that all of our body signals have to go through the limbic system into our more logical cortex in our brain. And then all of that logic has to go through our emotional center to our body. So in big ways, we're actually feeling beings who think, not the other way around. And that's, why.
Wait. Say that again louder for the people in the back.
We are feeling beings who think.
That's amazing. Love it.
Yeah. Yeah. So those emotions play a big part of our entire system, and when I'm dealing with the immune system, for example, and the neuroimmune system and how interlinked they are, and they are one and the same, um, this plays a big role in the overall healing. So when we have trauma, I like to say trauma with a capital T, trauma that happens to us, events that happen to us, our brain goes into a very protective mode, and it's that post-traumatic stress loop that can happen, right? And so our brain goes into a very protective spot, and it will spit out inflammation and signals and warnings anytime there's something that's going to remind you of that event to help protect you from doing it again. It can happen with traumas with a lowercase t as well. It doesn't even have to be that big of a slight to have this kind of big reaction. But chronic infections, chronic toxin exposure, chronic illness in and of itself is the same thing. It creates the same trauma loop. So it really affects our emotional center and our thinking center, and all of these things all intertwined. And so what happens is our brain, God love it, is trying to protect us, right? So it is just sending out signals all the time of inflammation and warnings and all of this stuff. So it can make it very, very hard to heal from a chronic illness because your brain is fighting you, subconsciously, like still thinking it's got to put up the fight. And so there are ways that we can retrain our brain to help it stop overreacting to things so that we can get to the other side of the healing bridge and work through that process.
Absolutely. It's hard to heal. It's impossible to heal when your brain constantly thinks there's a tiger in the room. Oh my God. Like even just that energy, you
Yeah.
think you're digesting food or, women, a lot of times their sex drive is completely gone. It's like our bodies aren't trying to thinking about having, reproducing and digesting our food. We're too busy in survival mode these
Yeah.
days. It just seems to like fish in water don't realize that they're in water, right? I think it's just been so pervasive in this culture of
Yeah.
stress, and it's kind of like a badge of honor, and it's not. It really
Yeah.
isn't. And so,
Yeah, and it becomes like, to speak to that, people will, I ask people all the time, how high is your stress? And they're like, oh, it's not so high. And they start listing off all the things. And it goes, you're so used to this high stress, you don't even think it's stressful anymore. That's terrifying. Our brains are not designed, our bodies are not designed to live in that tiger chasing you zone all the time. And they just always are. And it's this background stress that we don't even recognize as stress anymore. That's just shooting signals and adding to this as well. And you have, and you just, all of this layers on top of each other. And if we never ever get a chance to just and relax, our nervous system never gets a chance to relax, and then we can't repair, and then we can't recover.
so what are some of the strategies that you work with to help people get out of fight or flight and into rest and repair?
Rest and repair. There are several different ways to go about doing this, and typically I'm going to offer some more passive ways, especially at the beginning, because when we are so overwhelmed and we're so stressed out, adding one more thing to your plate just seems so overwhelming. Especially some of these programs, which we can talk about, and things that exist, they want you to do 20, 60 minutes a day. And just the thought of that is that's not going to happen when we're really sick. That bandwidth is not there. So I like to start with really passive ways, and there are some different approaches. So one is listening to binaural beats. Have you heard of that term?
Oh, absolutely.
Yeah, you guys talk about it. So just for people who, if they've never heard of it, the way I describe it, you listen to music with headphones, and it's got a different hertz in each ear. And the difference between the two correlates with different brain waves. So you can listen to binaural beats that are going to set you up for better sleep or less stress or better focus. And it's very passive. You don't have to do anything. You just listen. So you can put them on it, at bedtime or while you're studying, or, something, maybe not while you're driving, because that could just not too much, but
A disclaimer, do not do these tools while you are driving. You want to talk about stress.
yeah. There are also, wearables that can help just, kind of set off some frequency pulses.
I have 3 of them on as we speak. So I've got the Apollo Neuro, which is
Yeah.
the frequency pulse thing. This is a Ringcon, which actually tells me if I'm in stress, right? So it's one of those things where it could be really good to get that awareness, because I can look
Yeah.
at it and go, oh crap. And then I'm seeing the different exercises I'm doing and I'm seeing the stress go down. So now I'm better able to recognize what is stress and what's not.
Cool.
And then
Yeah.
of course my favorite is the Nikki, which I'm actually running on emotions right now to help, again, and these are all just tools.
Yeah.
They are not magic bullets. They are tools in a toolbox meant to be used with all the other healing modalities, but wearables can be great, uh, gentle ways in, right?
Yeah. Exactly.
What are some of
Yeah.
your favorites?
So the Apollo Neuro is one of the ones that I will recommend to people, and there's different settings on these things too, and they can be too much. Like, for example, when I use the Apollo Neuro under energy, sometimes it feels like I just drank way too much caffeine and I get jittery. It's too much for me. So you also, be aware of that and use different settings, or if you use it for shorter periods of time than maybe recommended to begin with, to kind of build up on these things. But you don't have to think about it. You just turn it on and you go, and it really can bring you to a different level and start to change some of the symptoms without having to really think about it or do much, and just while you're going about your day.
That's amazing.
So,
Go ahead and give us one more example, if you will, of like tools that you like using.
yes. So breathing. Breathing is another really simple one. And this is another cultural thing too, where we tend to be very shallow breathers and we're not using our diaphragm. And we really do need to use our diaphragm. And breathing is just a great way to just, let it out, let it go. And we spend too much time kind of holding it all in. And so there are
Especially
multiple.
women, we're taught to suck in our guts, right? Like it was one of the worst things. It's like, no, man, let it out.
Let it out. Yeah. And there are multiple different breathing techniques out there. And, there's yoga breathing and other things and Wim Hof, and there's all these kind of breathing techniques. But a very, very simple way is, I call it 4-8 breathing, because I think I can wrap my head around the numbers really easily. You breathe in through your nose for 4 and out through your mouth for 8. You do that 4 to 8 times in a row, 4 to 8 times a day. And it's really simple. I'll tell people, do this when you go to the bathroom. Do this when you're at a red light. I used to say do it when there was a commercial on TV, but no one watches commercials anymore. But just to
Thank
have like
God, because they're all pharmaceutical commercials that makes me want to vomit.
just those little triggers can be a reminder to do that breathing, so that you just kind of have that, like, mental reminder to do it. And it will help with, traffic angst as well. But just letting that go, because that's that rest and digest that we never really truly allow ourselves to get into, and just starting to like feel that. Do it with me right now. Right? See, that's nice,
I also
right?
like to have my clients do that before meals because then
Yes.
it sets them up for that, digest part, because so many folks that are wrapped up like myself wasn't digesting food for the longest times because my gut was too busy in fight or flight and was like
Oh, brilliant.
offline, right?
Mhm.
So
Yeah, great
doing
idea.
this a few times before you eat, a total game
Mhm.
changer with how you digest your food.
Yeah, great. Yep, love it. Yeah,
Yeah.
so there are some simple techniques to this, and there are some more in-depth programs and things available out there as well. When you really start to see the changes of this, there are several. So one of my favorites is called Primal Trust. There's Vital Side, there's the Gupta program, DNRS, which is kind of the OG original dynamic neural retraining system. So there are other techniques too, where you can start to get it in there. And I will tell you that the people that I can convince to do this work get better faster, stay better longer.
Ain't that the truth? And isn't it sad that we have to convince them? I had a client who worked with me for a year and a half, and he still didn't get it. Heather, I got really bad anxiety today. What supplement can you recommend? And I go, no. Did you get your feet out on the ground today? Did you get sunlight? Did you do your meditation? Did you do any breath work? No, no, no. No, I am not giving you another supplement. Like that's no different than a prescription. I mean, it's less side effects, it's usually healthier, but it's still not getting to that root cause, and it's not teaching him how to take charge of his own health, which like I said, the majority of these exercises are free. And they
Yeah.
only take seconds to a minute to do to get the body in the right state. And so That was a huge piece. Those that follow and do those exercises are the ones who get better and stay better.
Yep.
Oh,
Yeah.
thank you.
Yeah. And I think it's always important to just, to differentiate, because so many of my patients have been told over the years that there's nothing wrong with them. This is all in their head. They should go to psychiatry. And so I want to make sure that I really point out, this is not in your head. You're not making this up. These are very, very real physiological changes that happen from your brain through your center to spit out warning signals to your body and inflammation. This is very, very real physiological stuff that almost gets stuck in the on position. And so it's not that you're making this up. It's not that you just need Lexapro, but the good news is there are ways that you can retrain it, and you can work on repairing it so that your system doesn't have to over respond and have to feel that inflammation, that angst, that inflammatory pulse all day long.
Absolutely. It doesn't happen overnight, folks, but with steady, consistent baby steps, they add up to big wins over time. So
Mhm.
thank you for that. Dr. Casey, what are you putting out there these days? How can people find you? This is the shameless plug time of the show.
Yeah, you can check out our website. It's caseintegrativehealth.com. We're also on Instagram. There's Case Integrative Health. I also have my own. Dr. Kelley is on Instagram as well, and Facebook. So you can check us out there. Stay tuned. There's some good stuff coming out in the future, with more education for patients and some resources. So check us out in the new year. There'll be more stuff to tell.
Super exciting. Also, make sure to visit wearenikki.com/podcast and enter in BioBeats for 10% off. And like I said, because we love our customers so much and the way we show appreciation, we want to give a Nikki away, a Nikki watch, as well as a wellness set of frequencies on every episode. It's like a $5.98 value. So don't miss out. Go to the show notes. Make sure to check out Dr. Casey and to get signed up for the free giveaway. Good luck to you, and make sure to have a healthy day. Thanks for joining us.
Nikki plus Lyme is the next generation of Wave 1 technology referred to in this testimonial.
I had a life, and then I had Lyme. My life before Lyme was full of joy. It's very active, always on adventures. I had just written my first book and released a song, got to go to Nashville. It was just really accomplishing my dreams. Everything was really amping up career-wise. Then Lyme happened. So in 2015, I had a bullseye rash on my collarbone. My doctor actually very quickly dismissed me and said that there was no such thing as Lyme disease in Canada. So of course, I trusted my doctor. And then slowly, as months went on, another symptom would appear, another symptom would appear. And so just month after month, the list just kept getting longer and longer and longer. And every doctor just kept dismissing me or handing me anti-anxiety medication. I finally went to a naturopath doctor, showed him my list of about 80 symptoms, and he looked at it and looked at me and just said, "You don't recall ever being bit. This looks like chronic Lyme disease." And it was that moment where just the light bulb went off, and I went, yeah, I had a rash. It was like this whole new world that I was thrown into, where suddenly you're completely on your own and you're left to pay completely out of pocket and left to find the right treatment for you. And there were so many different kind of Lyme treatments and clinics, but they're all out of country and everything costs so much money. After having my son, he actually contracted congenital Lyme and was very, very sick. So he was put on life support for a month. That's when I felt like I really, really, really needed help. The big thing with Lyme is that you really become your own advocate and researcher. And some of the smartest people that I've met have had Lyme. They're almost like their own doctor, because you're constantly researching, learning, and how do you heal, and just having that hope that you can get your life back and get your health back, and that you're not going to be a victim to Lyme disease. And there was a friend that had mentioned to me that I needed to talk to a friend of theirs that had experienced amazing results with Wave 1. We compared stories, She shared hope with me, and she made the trip to see me and show me this wearable. Wave 1 was definitely the major player in my son's recovery. He had, his head would shake and his eyes would go back and forth really fast. I put him in his high chair, put it on his ankle, and he would just have it every single day for half an hour. And just in a couple weeks, his eyes were clear, his head stopped doing that. So I saw firsthand in a few weeks, I'm like, wow, like that, there's something to this. What I noticed with Wave 1 is because I had it and I had access to it every day, but there's the days that I didn't use it. If I go on vacation, I didn't bring it, and then I would notice, oh, okay, this is an old symptom I haven't experienced in a long time. I use it again, and then I wouldn't experience it again for a long time. So I was like, okay, there's definitely something to this. The Wave 1, having seen what I've seen, and the results, and the many testimonials, it just really makes sense. The thing that I just have wanted the most is just to heal with my kids and just have fun. And so for me, it just ignited this new spark, like our life is so short, our health is so precious. We made some big decisions. We moved our family to Vancouver Island. Nobody knew my healing journey. Nobody knew what we just went through. I just kind of felt like it wasn't Crystal with Lyme disease. It was just Crystal. Starting fresh has been really, really healing. So as the new me emerges, I feel health and healing has become definitely the forefront of my heart, and really wanting to help guide people to the right places to heal. Lyme disease has been, I like to say, our greatest teacher. And not only did it teach me a lot, but it really taught my family a lot about making healthy choices and how precious our health is.
Nikki plus Lyme is the next generation of Wave 1 technology referred to in this testimonial. Nikki puts a personal wellness center in your hands and on your wrist. Be better, do better. We are Nikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.